A team of Aussie and Indonesian archaeologists have unearthed a young Stone Age hunter-gatherer whose lower left leg had been amputated by a skilled surgeon. The find predates other such discoveries by tens of thousands of years and has huge implications for our understanding of medicine. Dr. Tim Maloney is from Griffith University and oversaw the archaeological excavation in Borneo, and Tim joins us now. Hi Tim, thanks for being with us. So tell us about how you made this find and what exactly did you find?
Good morning. So a collaborative team of Indonesian and Australian archaeologists, we were searching a very remote area of Borneo, which happens to be home to some of the earliest rock art known in the world, already uncovered by Indonesian archaeology. So we were searching caves, which hopefully you can see the excavation unfolding there, for archaeological records which might overlap with that rock art. In the process of that, we've uncovered what turned out to be Southeast Asia's earliest deliberate human burial. And this finding, the details of that skeleton that have emerged have essentially rewritten the known history of medical technology and medical understandings and care amongst humanity. This individual's lower left leg and left foot, absent from the burial, fragments that were recovered preserved a very compelling case for deliberate amputation surgery, which we demonstrate was at least 31,000 years old.
That's amazing, Tim, isn't it? So what were the signs that this was an amputation and not some sort of trauma, and also that the person survived the procedure?
So the fragments of the left tibia and fibula have during excavation, they presented with some very unusual distal bony growth. In addition to the complete absence of the left foot, we then enlisted the services of a paleopathologist, Dr. Melandri Vlok, to confirm that that unusual distal bony growth is a match of clinical instances for amputation from more recent modern medical examples of surgery. It completely lacks skeletal signals of infection, and it completely lacks the more characteristic fracture signals of animal attacks and crushing fractures from other injuries. So we've essentially got a very clear case for that remodeled bone, confirming a non-fatal pathology in this individual, and also that remodeled bone demonstrates somewhere a minimum of 6 to 9 years of healed bone after the surgery took place.
So the implication is it that doctors had knowledge about infection and blood loss? They knew what they were doing because this person survived.
That's right. It's extremely unlikely that this individual could have survived. This operation happened late in their childhood. It's unlikely that they could have survived without antiseptic and a thorough understanding of the need to manage shock and blood loss, enabling them to survive the procedure in a tropical environment where wound infection rates are accelerated due to the environment, but also a tropical environment home to today and likely into the deep past some of Earth's highest plant biodiversity, including a great many with medicinal properties, perhaps driving this early innovation in medical knowledge, we suspect.
Yeah. So it shakes up previous understanding, as you've been saying,
Absolutely.
when people were able to carry out procedures like this. So what are the implications of that?
A great many. The one that I think is most broadly appealing is that this is an individual living on the easternmost edge of the Ice Age Eurasian continent of Sunda, and it's from here that the earliest known mariners in human history departed that shoreline, earlier still colonising Australia and being the ancestors of the many indigenous nations of Australia today, the other islands of the Indonesian archipelago. So this is part of a build-up of evidence from Indonesian archaeology in particular that we're dealing with the world's first mariners, some of the world's earliest figurative artists, and now a good case for the world's first advanced medical practitioners capable of surgery, but also it's the earliest evidence of a high degree of community care. This individual lived into adulthood in a mountainous rainforest area without their lower left leg, and they weren't eking out an existence. These people were absolutely thriving in this challenging environment, practicing art and medicine of a way unprecedented until much more recent times. And in fact, it was relatively recently, towards the close of the 19th century in modern Western medicine, where amputations were often conducted by barbers, you were just as likely to die as not until those modern developments. Clearly, that understanding was present in this much earlier foraging and hunting community by 31,000 years.
Fascinating stuff. Dr. Tim Maloney, thank you so much.
Pleasure. Thank you.